Last year, at the same period, you had a lockdown in Quebec. You had police officers that were giving fines to Quebecers that were not respecting public health measures. This year, a year later, you're basically saying today that you have enough tools to manage your own risk with this Easter weekend?
Well, this is a good question, but the comparison between last year and this year is quite different because of the evolution of the coronavirus. We've experienced a lot of waves, and in particular the Omicron wave and this one, the A2. So the epidemiological profile is different. And with that in mind, it's expected that the evolution of the situation can be followed and managed without those major public health policies or measures that were populational and tough. And we think that the actual situation, even though it's tough and it's going to be so for a while, might be controlled with the contribution of all of us, and in particular the population that will be in contact or that are themselves more at risk for immunosuppressions or because they're elderly people. And with that in mind, I'm quite sure that it's feasible to get through that without the impact that we were afraid of last year. So let's move inside of it. So far, the system is sustainable. It's tough. It's a tough ride, but it's sustainable. And I think that the measures that have been taken so far are relevant for this situation. And in example, still suggesting that, we suggest to the government last week that we should keep on with the mask as mandatory for public dans les aires publiques
and
in the
public
transport.
spaces.
Yeah, public spaces. And as you looked at for other provinces and even elsewhere in the world, they are wondering why they did so, and they wish to bring it back, which is okay. It's their reflections, but for now, at least until the end of April, we'll keep it. And for that question that Mr. Laforêt asked me before, we'll see in the next few days where we should stand for the mask in regard of what's going to happen the 1st May the 1st.